Can other conditions be mistaken for fibromyalgia? Imagine feeling constant pain, fatigue, and mental fog, and wondering if it's fibromyalgia or something else. Many health conditions can look like fibromyalgia because they share similar symptoms. That makes diagnosis tricky and requires careful evaluation by a healthcare professional. One common condition mistaken for fibromyalgia is myofascial pain syndrome. It causes localized muscle pain with specific trigger points, but unlike fibromyalgia, it does not involve widespread pain. It usually affects certain muscles and doesn't have the systemic symptoms like fatigue or sleep issues seen in fibromyalgia. Chronic fatigue syndrome is another condition that can seem similar. It involves severe fatigue and pain, but it often includes signs of low-grade inflammation, such as mild fever or swollen lymph nodes, which are not typical features of fibromyalgia. Hypothyroidism, or an underactive thyroid, can cause profound fatigue, muscle weakness, and overall malaise. These symptoms closely resemble fibromyalgia. Blood tests measuring thyroid hormone levels help doctors distinguish hypothyroidism from fibromyalgia. Rheumatologic diseases like rheumatoid arthritis, lupus, or osteoarthritis can cause joint pain and fatigue too. However, these conditions usually show signs of inflammation or joint damage on imaging or blood tests, helping doctors tell them apart from fibromyalgia. Neurologic disorders such as multiple sclerosis or neuropathies may mimic fibromyalgia symptoms, but often come with neurological signs like numbness, weakness, or abnormal reflexes, and specific diagnostic tests can confirm these conditions. Endocrine disorders like Cushing syndrome or Addison's disease can also cause overlapping symptoms like muscle weakness, fatigue, and pain. Proper hormonal testing is essential to differentiate these from fibromyalgia. Infectious diseases such as Lyme disease or hepatitis can lead to chronic pain and fatigue. Blood tests and medical history help exclude these infections when diagnosing fibromyalgia. Vitamin deficiencies, especially in vitamin B12 or vitamin D, can cause musculoskeletal pain and tiredness, mimicking fibromyalgia. Blood tests for these deficiencies are straightforward and help guide treatment. Other conditions like polymyalgia rheumatica, myositis, hereditary muscle diseases, or complex regional pain syndrome can also look similar. They often have specific features or test results that help doctors identify them. Since fibromyalgia diagnosis relies on symptoms like widespread pain lasting at least 3 months, fatigue, sleep disturbances, and cognitive issues, doctors use a combination of medical history, physical exams, and targeted tests to rule out other causes. Sometimes a person may have fibromyalgia along with another condition, which can make diagnosis even more complex. The criteria for diagnosing fibromyalgia have improved over time, focusing more on symptom severity and widespread pain indices rather than just tender points. This helps differentiate it from other disorders. In summary, many health issues can mimic fibromyalgia, and accurate diagnosis depends on thorough evaluation. It's important to work with healthcare providers experienced in complex pain conditions. Proper diagnosis ensures appropriate treatment, which often involves a combination of medication, lifestyle changes, and supportive therapies. If you suspect you have fibromyalgia, seeking professional medical advice is the best step to understand your health and find relief.